To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hi, and welcome to Your Health. Today we're having a discussion around breast cancer, and I'm joined by Dr. Cynthia Geocaris from the Surgical Associates of Neenah. And doctor, let's get right into it. When and at what age should women start getting screened?
Sure. So the general rule is age 50 for the average person should go in every year for their screening mammogram. However, if you have any increased risk, family history, you should begin at about age 40. The other important thing to know is that you should get that mammogram every year. Don't skip, don't delay it, every year.
Now, when we think about mammograms, there are two different types of mammograms, aren't there?
Yeah, so the traditional mammogram is the two-dimensional mammogram, just that x-ray piece of paper that goes up and you look at. And then there is the three-dimensional mammogram. So the three-dimensional mammogram is more sensitive in picking up changes that can lead to breast cancer. So that's the one you want to ask for. So it's important. Ask your doctor, make sure they're ordering the three-dimensional mammogram, and then make sure that the three-dimensional mammogram is available where you're going. So often that is only found at the hospital site or the larger site. So if you live in a small town or you're getting that rural or maybe the mobile mammogram, they may not have the three-dimensional mammogram.
Right, so always check ahead of time.
Always check ahead of time.
And when we're talking about mammograms, you had mentioned earlier that some women are concerned that maybe they're harmful or they hurt.
Sure, so you should expect a little bit of pressure or discomfort with a mammogram, but they're short. It's short-lived. It shouldn't last after you have your mammogram. Just expect about 5 seconds for each side. Some people are worried about the radiation dose, but really it's a minuscule dose of radiation. The risk of breast cancer is much higher than the radiation dose. So remember, 1 in every 7 women nowadays are diagnosed with breast cancer. So this is really the best way to prevent or find something early on.
Get it early.
Get it early.
So there's really never an age that you need to stop screening, is there?
Not really. So I have a few patients I'm treating now that just said, oh, I'm 75, I shouldn't get that mammogram anymore. Now they're, unfortunately in treatment for breast cancer. So the general rule is as long as you're old enough to go to the doctor, you should keep getting your mammogram. So really never stop.
Early detection, so important because it can be treated.
Breast cancer is one of the cancers that's really easy to treat, and we have multiple ways to treat it. So I would get your mammogram every year.
Well, doctor, thank you so much for being with us and giving us all that good information. And thank you for watching To Your Health.
The preceding was a paid advertisement.